Hi everybody, I am absolutely delighted and honoured to have one of, I think, the leading women's health physios, not only in Europe, but I would say kind of globally. Grainne Donnelly has just gone from strength to strength, in terms of returning to exercise, postnatal guidelines, her work on diastasis. But what you might not know about Grainne is, first of all, that apparently she just doesn't sleep. But she also runs a really interesting exercise oncology rehab program. And I'm going to pick her brains for all your benefit here today. And we're going to talk about a lot of different things. But Grainne, thanks a million for joining us. And can you tell us a little bit about the program that you run?
Hello, Michelle. And first of all, thank you. I'm very humbled and surprised at your wonderful, kind words there. So thank you very much. As many know, I'm Grainne Donnelly. I'm a women's health physiotherapist based in County Fermanagh. And yes, today we're here to talk about my cancer rehab service. Cancer rehab and exercise is so important, and really we need to be developing more and more of these services. I founded a cancer rehab service with a colleague of mine based in Northern Ireland, Helen McElroy, who's a sports and musculoskeletal physiotherapist. And we recognise the need to develop these services, particularly in the rural areas that we are living in, just so that people can access help after, both during and after cancer treatments.
Absolutely. So how long have you been doing this? And, what were the barriers that you found in setting up this service? Because just even last night, I was looking on Twitter, and Nicole Stout, who I'm sure you'll be familiar with, was tweeting about how a patient's relative had reached out to her because this patient was in hospice care, and her doctor had said, although she's still expected to have many months to live, that there's no point really in rehab or exercise at this point. But I just think there's so much that exercise can bring in terms of quality of life. So, have you found good feedback from your medical colleagues, from the cancer patients that you're working with? How's that gone?
Okay, so I think first of all, I want to talk about why I got into this, because I suppose my background was always pelvic health and women's health, and although there's a really great overlap, I suppose like many people who get into cancer rehab, it's a personal journey nearly, because in my final year of uni, both my parents were unfortunately diagnosed with cancer. And my mommy had a really successful treatment and outcome from breast cancer, and unfortunately my father passed away after a 4-year battle with melanoma. So I suppose experienced firsthand the great medical care and the great core treatments that are available at the heart of cancer rehab, or at the heart of cancer treatments, but there was very little in terms of what happened once patients are between hospital appointments. There's a huge need for ongoing care and guidance in this population, particularly because they can go on to develop musculoskeletal and cardiorespiratory compromises because of the treatments, and these may happen in the months and years after having the treatments. And there just seemed to be this huge gap in, I suppose, knowledge and providing services for this patient population. And when you mentioned the idea of people who are in hospice care, I've actually had a lot of patients who have terminal diagnoses coming through my service. And I think there's a huge role for this, because these patients are traditionally shut off from access in many services, because community-based services for exercise, or maybe say that it's not suitable, they're maybe not sure of the risk factors involved with that, so they maybe can't access some of the community groups, and they really, really need ongoing support and care, just even to maximise their function and quality of life. So there's a few fond people that I'm thinking of, many who have been through the service and sadly maybe passed on since then, but they themselves spoke very fondly of the service and being able to access it, and not even just individually, but from a family point of view and support point of view. Their carers found that their cancer rehab appointments give them a focus and a need to get up, get changed, put on a bit of makeup, get out of the house. And it was that social interaction and just even that identity of living life as you are, and the life not being absorbed around cancer, basically, and getting out there again.
And I think that's really important, that, you know, we really want to get the message across that, you know, like, it's kind of become a little bit of a cliche now that, you know, movement is medicine. But essentially, from the minute you get that cancer diagnosis, that's your you know, the start to get moving. Because, you know, in terms of prehab for cancer treatment, during cancer treatment to mitigate the effects, and then again afterwards, there was some research came out last week, I'm sure you saw it, that, you know, up to 50% of breast cancer survivors die of a heart attack, you know, possibly because of cardiotoxicity from chemo. But also, I think, you know, very few cancer patients and very few of their medical providers, I think as well, realize that probably the best antidote for cancer-related fatigue is actually exercise. And so I think we have a job to get that message out.
Totally, I was saying, because like fatigue, in terms of fatigue management, exercise is the only proven evidence-based approach that we have for that cancer-related fatigue. But what's really interesting, there was a recent publication touching on what you said about pre, during, and post cancer diagnosis, that linked, or that compared preparation for cancer treatments in the same as people as NASA's approach to astronauts going into space, because they're exposed to the same risks of bone health or bone compromise, and the same risk of cardiorespiratory compromise. So they prepare months before going up to space. They have to do certain approaches during their space flight, and then there's the recovery process afterwards. And we need to be really integrating this approach with cancer rehab.
Great. I was at a conference in Beaumont Hospital in Dublin last week, and they were talking about breast reconstruction. And one of the key messages I think that came across there is that for breast cancer, it is urgent surgery, but it's not an emergency. So, you know, you have a little bit of a window of time to start getting into the habit of going out for a walk, which I think is probably one of the best things you can do for body and mind, you know, to start getting the system prepared. But, you know, I think just even looking at the biopsychosocial benefits, and that's such a buzzword, isn't it, in physio at the minute, but, you know, the sense of purpose, of empowerment, of improving function across all those domains. What do you think is the best type of exercise for people going through or after cancer treatment to start integrating?
Okay, well, as you mentioned, yes, the simple things, first of all, like getting out walking and just getting that habit of regular exercise. But really, in terms of exercise, we need to be considering, I suppose, addressing the potential cardiotoxicity and also the bone health compromise. So we need a combination of both aerobic exercise and resistance training. And the resistance training is one that, I suppose, there's a traditional school of thought in terms of cancer and exercise and take it easy and hold back and maybe wrap people up a little bit. But we really need to be doing, I suppose, starting off gentle, but doing graded resistance training, because we have to think of preventing comorbid conditions. We have to be thinking of maximizing that patient's function, and we have to be thinking of the long-term plan, because lots more people are surviving cancer. So cancer survivorship is a huge thing now, which is great, and it's owing to better, I suppose, better diagnoses and better treatments. But we need to then address this population and their growing needs in terms of maintaining their long-term health. So yes, and I have a huge, I suppose, approach in terms of exercise. I think it has to be something that a patient enjoys. I think that's really important across the board, but particularly with cancer, if they're going to make, I suppose, make the effort to engage in something, it has to be enjoyable, so that again, it's feeding into that biopsychosocial approach where mental health, the endorphins we produce with exercise are so important. They're so important in any area of health, but particularly with cancer patients. And I'm bringing it back again to that idea of their identity, because a lot of cancer patients maybe have hobbies and sports and exercise that they like to do. Getting a cancer diagnosis is a huge blow, and it may initially mean that they have to step away from that high level sport or that particular sport or exercise or even hobby like gardening that they enjoyed. But it's really important that cancer rehab specialists address patient specific goals in order to help them get back to the sport or exercise or hobby that they want to do, because life's for living, and where possible we need to be doing and enabling and facilitating rather than inhibiting. And the traditional approach with cancer tended to be to do the opposite, nearly to wrap people up, to have them sit and, oh no, don't you get up, I'll fetch you that. Whereas we need to be empowering people and getting them functionally active again.
Absolutely. And I suppose as well, just to give a focus on, do you know what, you're still here, you know, and as long as you're still here and you're above ground, there's more that's right with your body than there is going wrong. And let's maximize that as well, you know. And I think kind of, you know, exercise prescription in terms of managing fatigue particularly, because it's not altogether intuitive that if you're feeling tired, what you actually need to do is get up and move, you know. And I think to be able to give some education around that is vital, isn't it?
Completely. And funny, one past client springs to mind. And again, we're having younger people being diagnosed with cancer as well. So, you know, it's not just, often people used to think of cancer as something that as we get on in life, but I've had plenty of young women diagnosed with cancer. And again, they're usually very active into sports. And this particular girl thought she'd never play Gaelic football again. She thought that was it. And she had, fatigue was one of the main side effects of treatments. She couldn't even walk 10 minutes to the shop, and it would floor for the next few weeks. So we actually integrated, after education and explaining the approach of it, we integrated rehab beginning at, well, you know what, you're not going to walk to the shop, you're going to walk halfway, turn around and come home and see how you get on. And once we started to get an entry level where she was like, oh, I can do this without it flooring me for the next few days, she was able to, one, get excited about the idea of exercising and seeing, I suppose, the light at the end of that tunnel, where we gradually built up her exercise. And once you start to overcome the initial, I suppose, stages of fatigue, it actually can kind of increase quite quickly. Then, you know, the first stages of increasing or overcoming fatigue management are the hardest. And I'm glad to say, finally we've progressed back and she's back to playing inter-county football. So
wow,
it's fabulous.
Amazing.
But again, that was her identity, and that's huge.
So just even the social inclusivity of being able to get back, you know, and training with her teammates and with the club, and, you know, the whole kind of social circle that goes along with that, you know, from a mental as well as a physical perspective, that's huge, isn't it? I think, Grainne, as well,
yeah, absolutely.
you know, if we think about, you know, kind of, I know you were talking about somebody who's a bit younger there, but the key demographic for breast cancer is women in their 50s and their 60s. And of course, these women are also dealing with peri and post-menopausal issues and the issues of aging too. So, you know, these are women who are probably already more likely to develop problems in terms of gluteal tendinopathies, rotator cuff issues, posterior tibial tendon problems. So do you think strength training is obviously important from a bone health perspective after cancer treatments, particularly chemo and radiation? But do you find that women are responding well to the strength training aspect that you include?
Completely. And again, you've already mentioned, or you've touched on it really well there, because a lot of the women who come with after breast cancer or even after gynae cancers, their main issues or complaints are maybe nothing to do with the site of cancer, and they can be the rotator cuff issues, they can be general weakness in the muscles, and again, that can be as a process of the stage of life that they're at, but also because of the side effects of the chemotherapy and radiotherapy that has on muscles and connective tissue in general. And which is really interesting is I treat a lot of pelvic health physiotherapists by bias, so everything becomes about pelvic health when I'm treating people, which happens. But a lot of these women are predisposed to, I suppose, I think their risk factors are increased for everything like urinary incontinence and you know, even bowel issues that many women experience. And again, I think it's all to do with, combined with the stage of life that they're at, but the side effects of the treatments and the general deconditioning and what that leads to.
Yeah. And I think as well then, you know, if you add on the propensity maybe for a bit of weight gain as well, because, you know, if nothing tastes good, you know, you want to maybe go for things that are very sweet or high in fat, that have good mouthfeel, and then maybe you combine that with some inactivity, weight gain, and then the issues around urinary and bowel continence and prolapse, of course, along with the estrogen deprivation, you know, if we're looking at hormonal treatments. So I think it's really important, isn't it, that we're looking at the whole person, you know, and not just a shoulder or a pelvis or issues like that. I want to just talk a little bit about lymphedema, because that's an area that I think there's still such a shroud of mystery around, particularly around the safety of exercise in lymphedema. And I wonder if you could just share your thoughts with that.
Sure. So just like I said, first of all, I'm not a lymphedema therapist, so I don't do the core treatments of lymphedema, but I link in very closely with my wonderful colleagues close by who do. But there's lots of, I suppose, more evidence emerging that exercise actually is safe to do and should be promoted with lymphedema. There used to be a school of thought that exercise could actually exacerbate lymphedema, and so it was very much a cautionary approach. But we're now finding that studies are coming forward to say that it could actually prevent and limit the, I suppose, the severity of lymphedema. But there's certain things to be mindful of in terms of, I think that you have to take a very graded approach because you don't want to overload that area. And you also have to be very mindful when training with people, when, I suppose, to take precaution, because infection is one of the, I suppose, highlighted risk factors for developing lymphedema. So if anyone has any sort of injury or cut, they need to rest and treat that injury or cut in that limb before maybe progressing on to overloading and exercise. And yeah, but I do think it's really important. What's your thoughts on it? Because I know that you do a lot with lymphedema.
Yeah, I think, again, I'm not a lymphedema therapist, but I think one of the key messages, and that's kind of borne out in the research, is that strength training is actually vital for improving the resilience of the lymphatic system. But like you were saying, you know, a very graded approach that you do a little bit, you give the body 24 hours, see how it responds, no problems. You know, you can ramp it up a little bit. And I think, you know, one of the key things that we can bring across to women, particularly breast cancer survivors, is just the message that there's no such thing as a little bit of swelling, you know, in that arm. And we always want to try and stay ahead. And it's about risk reduction, isn't it, for lymphedema? Not that we're going to avoid it, because I think then if a woman develops lymphedema, there's a lot of self-blame and issues around that. But I think anything we can do to empower women about how to take care of themselves, and just generally the evidence really seems to be in favor of exercise as a preventative, but like you said, on a very graded approach. It really does seem to be, you know, a magic pill for a lot of the side effects of cancer treatment.
Absolutely. And even in terms of with anybody who has lymphedema, obviously that limb is significantly heavier, and they've shown with the research too that it's really important for function of those limbs in order to maintain even shoulder strength and everything, so that limb is functional and isn't one that's considered out of bounds, because we need to be empowering people and we need to be maintaining them long term, as we've discussed. The other thing, I was going to say something to do with breast cancer, and now it's completely gone out of my head, but I was thinking it's something to do with more breast cancer in general, but it'll come back to me. But in terms of treatments and surgeries for breast cancer, the other thing that's really interesting is that somebody who undergoes maybe reconstruction with breast cancer and has, say, a tram flap, they have, I suppose, we have to address the compromise that they may have in their abdominal and core areas. So we have to think of what exactly that patient has underwent and how we need to address it, and not just focus on the surgical site.
Absolutely. The donor sites are often neglected, aren't they? Whether we're talking about trams, but I think even also in the microsurgical ones, you know, the tugs and the DIEPs, you know, or even the lat flaps, you know, like what's happening to their back, what's happening to their upper inner thigh, and consequently their pelvic floor muscles, and are those scars getting good management as well? You know, what about, Grainne, can I just ask what your thoughts are then on precautions? You know, can you work with somebody in your experience going through chemotherapy? You know, are there any contraindications or precautions that you found particularly useful to keep kind of front and center?
Yeah, I think it's really important that anyone dealing with patients after having a cancer diagnosis are, I suppose, trained and access training so that they are up to date and know to look out for certain precautions, because this population, it's really important that we keep them safe and well enough to continue undergoing their cancer treatments, because any infections, any, I suppose, compromise to their bloods will prevent that treatment. But things like anemia, so if their iron levels are below 12, we want to consider that, or even thrombocytopenia, which is their platelet count, and that's a really important one, because don't want to compromise any, I suppose, bleeding, and particularly internal bleeding. And if someone, generally it's great with the cancer population because they do have regular blood, so you usually have quite up-to-date measures. But if someone's coming to you and they aren't sure, signs of thrombocytopenia might be even like easy bruising. So if someone's coming with lots of bruises, or they've even got red discoloration that doesn't, usually when you press it, it doesn't go away. And that can be some indication, or if they're having nosebleeds very easily, coughing up blood, anything like that there are trigger signs for thinking, well, maybe we want to get their bloods checked again before we continue. If someone has slightly skewed bloods, but they're well enough to continue exercise, you just want to be mindful to maybe scale it back and to listen to that person. Regardless of if someone's bloods are okay, I generally think that it's really important to go by how the patient is feeling. So if that patient is reporting that they just aren't feeling on form today, you have to listen to that, because you know our bodies are really intuitive. But even other things, like if they've had diagnosis of metastases, particularly bone metastases, you want to be very careful that you're considering that in your rehab approach. And I'm trying to think, infection, if they have any sort of active infection. But more so, I think it's really important that anyone dealing with patients with cancer rehab, if you have any infection or anyone in your household has any infection, I think it's so important that you be mindful and plan ahead and maybe cancel and reschedule an appointment, because we cannot risk this population.
Absolutely, absolutely. I think it is a lot of it comes down to, doesn't it, control your controllables. You know, if you have sniffles, yeah, and someone is in active chemo and they're kind of reaching their nadir of immunity, you know, just reschedule. Like you said, just have a little bit of sense, practice basic good hygiene, washing your hands, wiping equipment down, things like that. So what does your cancer rehab program look like, Grainne? Can you just kind of talk us through the structure of someone's had a breast cancer diagnosis, for example, and they hear that, you know, you're offering this service. What does that look like from a consumer perspective?
Okay, so again, I set this up after, I suppose, having that personal experience of both parents having cancer, and the whole ethos of it was that I wanted to set up a non-profit service, which I thankfully successfully did with the support of Northern Ireland Cancer Charity. Now, this was quite difficult initially setting up, because I approached several charities who thought it was a wonderful idea but didn't have the funds. Like everything, money's tight. So thankfully Action Cancer came involved, and we are able to offer someone access to 6 free sessions of cancer rehabilitation, which is wonderful. And then if they want to continue beyond that, they can access it and self-fund, but I still offer it for a non-profit rate. They can access at any stage of their journey, whether that's before, during, or after, and they can actually re-access as the stages change, you know, and they can access it via the free to access service. And have a service for guests, it usually has a waiting list, which it does, because I'm only able to offer 3 of those free sessions per week. I really enjoy it. At the minute, we do one-to-ones with everybody, and it's so individualized and tailored, and it's an hour session, and I love the relationships and the rapport and getting to know people. I've been able to get to know so many people who I would consider friends now, after coming through the service, and their families. You get to know their families as well. But we've also, Helen, my co-founder, is actually in the process of developing a group-based exercise class that they can access once they've been through the one-to-ones. And I think at the minute we really wanted to go through that one-to-one so we individually know people's needs and prepare them to be ready for that group exercise class. And again, that's a step closer to them then deciding that they can join local gyms and things, because they're going to be so empowered with the knowledge to then take that on board themselves. I'm not in the position myself in my own clinic setup to run groups at the minute, but that may be something that occurs in the future. And basically, I just think that there needs to be more of these services developed. Now, I was able to access this after I did the Pink and Steel training, which I'm sure many people know of Lou James, who was the founder of Pink and Steel. She's based in Australia, and I was in the first intake of the international rural scholarships. So it was from that, everything just came at the right time. I seen that at a time when I was looking for, I suppose, more services to develop in this area, and I went for it, and I haven't looked back since, basically. I think it's really important that general hospital service to develop in this area, because at the minute what I am noticing is there can be such a disconnect between services, Michelle. I'm not sure what it's like in Ireland, but people can have a cancer journey, they can go through all their treatments, they might still be involved in infrequent oncology follow-ups, or they may be discharged from services, but then they get that frozen shoulder and they're referred into musculoskeletal light patients, and maybe their cancer history is not even considered. This is treated as a rotator cuff or a frozen shoulder just in isolation. And I'm trying to increase the knowledge and awareness there that this is all linked, and they may have been predisposed to this because of their cancer and their treatments, and we need to be addressing the whole factor and the whole person.
Well, I think that's a really important point, because particularly if somebody has a cancer diagnosis in their past, say 10, 15, 20 years ago, they might not even think it's relevant to what's going on now. But, you know, particularly with radiotherapy, you know, you've got that progressive fibrotic nature of it. You know, it will continue to, you know, it is the gift that keeps on giving, isn't it, over the years? And I think as well, you know, what you just kind of circling back to what you said earlier about, you know, being a women's health physio or pelvic health physio, I think particularly for cancer survivors, whether it's breast cancer or gynae cancer, who are maybe having some pelvic health issues, I feel sometimes like the women's health physios are scared of the cancer end of things, and the oncology physios are scared of the pelvic health end of things. And I think, you know, what we want to do is to really kind of empower and just create a safe way for all patients to be screened for, you know, entire mind and body, you know, going on here. Because if you're afraid you're going to leak, I mean, we know that's a barrier for about 50% of the non-cancer population from exercising. So if you're afraid you're going to leak, you know, there's some interesting research out there about the effects of chemo and radiotherapy on the microbiome. If you're on estrogen deprivation, you know, if you're going down that path as part of your treatment as well, all of these things play into pelvic health. And if that's your barrier towards movement, you know, I think it's definitely something that we can offer a huge amount with. Even I think, like you were saying, like the scars on donor sites, you know, if someone's had a trauma or if someone's had a DIEP, you know, what effect does that abdominal incision have on, you know, on their ability to move, to even connect with their abdominal pelvic region, you know?
Yeah, absolutely.
There's a huge amount of work to do, but I think we're making strides.
We are, and some of the things I've really had my eyes open to as I've went through this service development is that there's a fear, first of all, that can surround patients, and that's why I think these services are more and more required, because many patients who had surgery and treatment, say 10 years ago for breast cancer, were told at that time by the consultant, don't lift anything heavier than half a kettle full of water, and they're coming 10 years later, still only lifting half a kettle of water. And when asked about it, I'm like, well, are you having any issues, you know, with that limit this time? No, but that's what I was told. So it's nearly gospel, because the consultant. So we need to be breaking traditional concepts and thoughts, and even making sure that people are accessing progressive rehab and education, because what's appropriate education for them at that period of time when they've just had surgery is not the same as what's required for 10 years down the line.
Yeah.
But there's also a fear that surrounds, or I suppose a lot of people with cancer, particularly with cancer survivorship, feel so, I suppose, grateful that they have survived the cancer, that sometimes they're afraid to complain about the little niggles and pains and aches that they have as a result of cancer treatments, or as a result of the increased risk with cancer treatments. And I want to put the message out there that it is totally, absolutely fine and important that they do complain about these issues that are common with all cancer patients because of the treatments and what they've been through, and that they need to get help with this in order to completely overcome or to live their best life, do you know what I mean, and not to feel guilty about complaining about them.
Absolutely. And I think that survivor's guilt is a huge issue. I think it's been documented fairly well in the literature, particularly around gynae cancer survivors. Trish Malone in the Mater Hospital did a lovely paper on that a couple of years ago. But I think a lot of that could stem from maybe their oncologist's lack of awareness, because I remember a couple of years ago when the PAL trial came out about weightlifting for lymphedema, and it was in, I think it was the New England Journal of Medicine, there was uproar about it, you know, because this is the way we've always done it. So, and now you're saying that has to go out the window. So somebody might hear, you know, from their surgeon when the drains are still in, don't lift your shoulder above 90 degrees. And they might think, well, I can never lift it above 90 degrees again, you know? And I think there's certainly a role for us as physios, but I think also for fitness professionals, for exercise physiologists, to just be a bit more confident and a bit more competent as well in their knowledge base around exercise prescription for cancer survivors. Because once you've had that diagnosis, for the rest of your life, however long it's going to be, you know, and none of us know. I mean, you know, none of us know how long we're going to be here. But in terms of just living well and living your best life, as you said, you know, it's one of the things that we can actually empower people to start taking control of. And instead of them sitting there and having things done to them in terms of receiving chemo or radiotherapy or surgery, this is actually something they can do for themselves. So we have to make sure that it's a safe space for them to work in. And that's why I think, you know, kind of conversations like this are important, because the first step is to get clinicians and fitness professionals aware of the exciting possibilities around exercise prescription. Did you have good feedback or good interaction with the medical community, with the, you know, with the oncologists or the local hospitals? Were they supportive?
Local hospitals have been great in terms, particularly with my physio colleagues, because I'm having a lot of them, I suppose, signpost women who are ended up in musculoskeletal patients. They're making them aware of this service, and even the, I suppose, the oncology physiotherapy service, because it was limited in terms of funding and sessions. They were then signposting on towards me, which is great because you're getting people into the community too. And what I like about the service that we set up is that it's based in the community, away from the hospital. Again, so you're kind of transition, and even because there's a lot of fear associated with going to hospital appointments, because that's where they heard their diagnosis, that's where they've had follow-ups for treatment. So it's just, again, getting them back into that community environment and empowering them. But where I want to increase more awareness is getting more into the oncologists and the medical world, because I'm finding that a bit more difficult to, I suppose, get involved with and get good communication and links with, because really, I think oncologists should be signposting people to the services like this.
Definitely, and I think there's a role, isn't there, even for shoulder prehab. You know, the better shape you are going into, whether it's a mastectomy or a wide local excision, you know, the better shape you are going into it, particularly if you're going to need radiation afterwards. Like if you have to be able to get your arm up overhead, and the loss of range of movement is a barrier towards you getting your radiotherapy, you know, that's an issue. But just even in terms of, you know, there's good research, isn't there, out there about how exercise can actually not only reduce the side effects of treatment, which we've been talking about, but actually reducing the risk of recurrence. You know, it's a really powerful medicine.
It is, and it's the reoccurrence of cancer, but also the development of comorbid conditions, because again, if people are getting less active and they then start to enter obesity, or their increased risk factors for diabetes and all these other things that can significantly impact on their physical and mental health, you're just adding to it. So we need to, as you say, control the controllables and do what we can. But also, particularly, I'm a huge fan of prehab, in terms of people get a cancer diagnosis and maybe waiting and counting down the days to that date till they're getting active treatment, and that can be a very stressful time and worrying time. Whereas a good way of maybe managing that is keeping active, keeping busy, enjoying getting those endorphins produced, and really helping counteract the fear associated with it. And also giving that empowerment of, I'm still active, and I'm starting to build up my activity and feeling good with it. I can't wait until my, you know, the surgery is over and I can start to get back to this. So they're already in the way of kind of doing exercise.
You know, they have a plan, you know, and I think that's once you have a little bit of structure, that can really help diminish that fear factor, because you know that, yes, I'm going to be in hospital, I'm going to have the drains in place, but then once the drains are out, I have a plan for getting moving. And just even in terms of the benefits for your immune system and recovering from all these treatments as well, because you know, it's recovering from cancer treatment, probably even more so than recovering from cancer, isn't it?
Absolutely, yeah, that's the hardest part in the body, especially with the likes of the cancer-related fatigue, is only something I can empathize with, because that's the main complaint that people have. It's the hardest ones to get over, because as you say, people can get a good night's sleep and they can wake up and still feel as bad or worse than they did yesterday. It's just that fog that comes around. But the other things even that I think are really important for exercise and getting out and about is the idea of the side effects of even chemo brain and that fogginess it can give you, because again, we're getting out, we're stimulating, we're kind of getting over it, and we're not letting that side effects such as that like get on top of us and accumulate and limit what we're doing.
Absolutely. I mean, I think as long as we're, you know, we're sensible about exercise prescription, you know, teaching people maybe not to wrap TheraBands around their hands, you know, if they are at a risk for lymphedema, you know, little common sense things like that. I think just to give people back that sense of control and agency over their own health as well, so that they are not only part of their healthcare team, but they're actually leading the healthcare team as well, and that they know that they're doing, the evidence supports that what they are doing is actually a huge contribution to their recovery. Grainne, I could keep you here all day, picking your brains. Sorry, was there something you were going to say?
I was going to say it was interesting because we know, and you know, and you've mentioned a lot of the evidence that exists out there. There's great cancer strategies around the world. Australia, America have great ones that really highlight the role of exercise pre, during, and after cancer treatments. And the Irish Cancer Strategy, which was produced recently, did highlight the importance of physical activity and lifestyle. But it mentioned that the research was still in development, which I think there's such an abundance of research. So I think that we need to have things like we need our own local strategies updated, a bit more empowering, so that people are all accessing the real information.
And I think, you know, starting the conversation and just getting people talking, showing the evidence that's out there, and, you know, I know it's kind of popular at the minute to not be a fan of Facebook and social media platforms. But I think particularly platforms like Facebook, like Twitter, like Instagram, they can actually be tools for great social change, because we can diminish the fear factor, do a little bit of myth busting, and actually show, you know, that no, this is what you need to do, both as a clinician or, you know, a fitness professional, but maybe also you don't know who's coming across the posts that we put out there on social media as well. And if we even just manage to reach a handful of women who are going through or after breast cancer particularly, but I think anybody who's going through the cancer journey, you know, the evidence, the recent ACSM guidelines, you know, were really encouraging in terms of, like we said, preventing recurrence for breast, prostate, you know, colorectal, lung. It's a long list. And what's the worst thing that's going to happen from adding a bit of exercise and movement into your life?
Exactly.
What are the side effects, you know? Grainne, I can't thank you enough for sharing your wisdom and your insight, and I just think as a profession we're very lucky to have you, and particularly with that crossover from pelvic health to oncology to movement, and I really think that I hope that people watching this will have gained a lot. Where can people find you? Your website, your social media? Give us a shout.
So I am on Instagram, Facebook, and Twitter. Instagram and Facebook, I'm under absolute.physio. Twitter, I'm under @absphysio, but if you search Absolute Physio, you'll find me. But we've also got a social media platform for the Spark Cancer Rehab service that we developed. So if you just search Spark, you'll find it, and we're putting up lots of cancer-related content. I'll share this interview on it. So if anyone wants to find out more, in particular in cancer, they can follow the Spark page as well.
Brilliant. Grainne, thanks a million, and hopefully I will see you in real life soon.
Thank you so much. Bye.